This is a 58 years old female, and she has reported with menorrhagia, again bleeding per vagina. You see her liver is cirrhotic. She is unaware of the fact, and there are calculi, multiple tiny calculi within the lumen of the gallbladder, and the portal vein is seen at its right angle. It's not dilated, and this is the gallbladder, and these are the calculi with all that which is giving posterior shadow from here to here. This is the right diaphragm, and the outer surface of the liver is irregular and surrounded by fluid. It is coarse, the texture is coarse, no focal lesion is seen in this view, and so this is the kidney, right kidney, and this is the liver. So this is a shrunken liver. See, the outer surface is quite irregular and is surrounded by fluid. Spleen is enlarged, measured 134 centimeters from pole to pole, and there is ascites in this patient. You see, this is fluid in the pelvic region and in the pelvic, from pelvic to the peritoneal cavity. This is ascitic fluid in which you will see the bowels are floating. Now, after seeing this, here you will see the uterus. Now, this is the uterus, which for the age of the patient, postmenopausal, with a history of bleeding again after a pause of some years. I can see a focal lesion within the posterior wall of the uterus, which is giving whirly appearance, echogenic, solid, no posterior wall acoustic enhancement. This is the fibroid, leiomyoma. This measures 48 into 40 millimeters, with this being the uterus, funda, anterior wall, because we are seeing the uterus in transversection, and the measurement of the uterus in this dimension is 7.5, which is significantly more than expected norm for this age of the patient. Now this is longitudinal, this is transverse, and I am going to turn the probe, keeping the fibroid in the center of the image longitudinally to get the longitudinal view. Now in this dimension, in longitudinal section, this is the mass which is in fact a fibroid. This is a mass which is in fact a fibroid. It is very well demarcated. See, and it shows whirly appearance. There are cystic appearance areas within this echogenic area. No posterior wall enhancement is seen. Now these finding is consistent with uterine fibroid in enlarged uterus Both are abnormal for the age of the patient. And the another thing to note is that this is the endometrial canal, and the endometrial canal is taking a sharp turn anterior to the fibroid. Same is the case here. This is the endometrial canal and is elevated above this fibroid. There is small fluid is seen in the pelvic cavity because of cirrhosis. This is fluid. This is fluid. These are the bowels, and this is the uterus. The anterior. This is the anterior wall of the uterus. This is the fundus, and the mass is in the posterior wall. So this is the uterus, longitudinal section. This is the uterus in transverse section. This is the uterus in transverse section, and the mass is in the posterior wall. Okay. So we see a fibroid in a cirrhotic patient. The age of the patient the age of the patient is about 65 years, 65 years. Let's get the dimensions of the uterus.
पर भी देखेंगे
वही देख रहे हैं. So this is the transverse section, this is the longitudinal section, and the uterus measures 9.7 centimeters by 6.2 centimeters by 6.3 centimeters, and the normal dimensions are for this age much less as compared to that what you are seeing. Definitely a large uterus, no doubt about that, with solid focal mass lesion elevating the endometrial canal. One reason for menorrhagia, you can see that the endometrial canal is being elevated. This is the endometrial canal, this line, and the fibroid is elevating it upwards. This is the anterior segment of the uterus, this is the posterior segment of the uterus. So, in transverse section, again you will see that the endometrial canal is being, this is the endometrial canal, and it is being elevated by the mass. This can be one reason for menorrhagia, and second reason can be the cirrhotic liver itself by disturbing the prothrombin time, FPTT, albumin. She can have these. It's not unusual for her to have bleeding for vagina in this age. This is the endometrial canal, and let's see that this is the fibroid, and this is the endometrial canal, this one, this area, and the endometrial canal, rather going straight, is curving around this solid echogenic area with internal cystic areas, which is a fibroid of early appearance, giving a early appearance.